Understanding the AA gradient can improve the way you manage your patients. At first, the equation looks long and consequently, some think it's a difficult concept, but it's actually easier than you think, and it all hinges around understanding what PO2 is. So let's start with this illustration. If a basketball player wants to play, he needs to make sure there's plenty of air in the ball. He could easily stick a gauge in the ball and determine how much pressure is inside it. And if you understand that concept, you'll have no problem with the AA gradient. In the AA gradient, we have to determine the pressure inside oxygen, because like a basketball, there is pressure inside one tiny invisible oxygen molecule. How do you know how much pressure is inside this tiny invisible oxygen molecule? Well, here's how. I call this the 4 A's. Let's start here. To determine the pressure of oxygen in our atmosphere, take the barometric pressure and multiply that by the concentration of oxygen. So at sea level, the barometric pressure is 760. In our atmosphere, the concentration of oxygen is 21%. That means that the pressure inside an oxygen molecule before we even inhale it is about 160. But once the oxygen is inhaled, it will lose pressure. In fact, it will lose pressure as soon as it reaches the second A, the airway. Now the equation looks like this, and that's because there's this amount of water vapor pressure in the trachea, and this pressure takes some of the pressure from the oxygen molecule. So notice that in the atmosphere, the pressure inside oxygen was 160, and now in the airway, the pressure has decreased to about 150, and it will continue to lose pressure by the time it reaches our third A, the alveolus. In the alveolus, the oxygen molecule will lose pressure because of the CO2 that's already in there. Now, how much CO2 is in the alveolus? Well, for a normal patient with normal lungs, the normal range of CO2 is 35 to 45. A perfect CO2 is 40, so we'll stick with 40. And we have to determine how often CO2 leaves the body. And on average, the amount of CO2 that leaves the body in 1 minute is about 200, and the amount of oxygen that enters the body is about 250. And dividing these two gives us a respiratory quotient of 0.8. So here's what our equation now looks like once the oxygen reaches the alveoli. And if you plug in the normal values, this means that the normal amount of pressure inside an oxygen molecule by the time it reaches the alveoli is about 100. And we express this as P capital A O2 because this is the pressure of oxygen inside the alveoli. So let's recap really quickly. If I asked you, what is the PO2 in the atmosphere at sea level, you would say 160. Or if I asked, what is the PO2 in the airway, you would say 150. And if I asked, what is the normal pressure of oxygen once it reaches the alveoli, you would say 100. But we're not done. Now it gets really exciting. Hang in there. The last thing we need to do is determine if the patient has adequate PO2 in their blood. Because once oxygen reaches the alveoli, it must diffuse or jump in the blood. And to obtain a blood sample, a respiratory therapist will get an ABG. That means the sample of blood comes from the artery, our fourth A. And the respiratory therapist will find out what the pressure of oxygen is now that it's in the artery. And this is referred to as P little a O2. And if there is nothing getting in the way of oxygen to jump into the artery, then the pressure of oxygen should be the same. However, if a patient has lung disease, it could cause the oxygen molecule to lose pressure by the time it reaches the artery. This loss of pressure is referred to as a gradient. So when we look at the AA gradient, we're looking to see how much pressure was lost. We know what the pressure should be by doing this equation. We know what the actual pressure is when we obtain a blood sample. So let's say a patient is on room air of oxygen. The therapist obtained an ABG and saw that the CO2 was 40 and that the PaO2 was 65. What is the AA gradient? Well, we already know what the PaO2 should be. The actual pressure, however, is only 65. Therefore, the gradient is 35. Now let me ask you a question. Is that gradient normal? There's several methods to determine if this is normal. I'll choose the easiest method. Look at the FiO2. In this case, 21%. If the gradient is less than the FiO2 value, it's considered a normal gradient. In our example, 35 is not less than 21. Therefore, for this patient, this is not a normal gradient. It's abnormal. Let's do an example on your own. I'll ask you 3 questions. First, what is the P big AO2? Second, what is the AA gradient? And lastly, is the gradient normal? So here we go. Hit pause right now, and when you're ready, hit play to see the answer. How did you do? If you got it right, awesome, you nailed it. If you got it wrong, go back and review where you went wrong and try again. Let's do one more. Remember, hit pause now and hit play when you're ready to see the results. So how'd you do? If you're 2 for 2, that's awesome. You got it. What we don't want is a very large gradient. That tells us the patient has some sort of lung disease. And if you've determined that the pressure of oxygen in the artery is too low, you can actually help increase it. Just like a basketball player can add more air into the ball if the pressure is low, a respiratory therapist can increase a patient's PaO2. Here's what you can do. You can increase the barometric pressure, and this can be done by placing the patient in a hyperbaric chamber, or giving a positive pressure device, or even adding PEEP. Or you can simply increase the concentration of the delivered oxygen, because increasing the FiO2 should help increase the PaO2. Lastly, you can help the patient get rid of more CO2. This is typically done on a mechanical ventilator. And as the CO2 decreases, the PO2 may actually increase. So now you know what the AA gradient is and how to determine if it's normal. You also know some of the ways to help increase the pressure inside the oxygen molecule. And now it's up to you to use this tool and help improve patient management.